How come we don't have more indoor testing sites, particularly for the elderly in this inclement weather? And how come we can't have a site, a test site, restricted to only Lawrence residents? I know the stuff down the hospital, that's another thing, but I go up to Manchester Street. Why can't that be, strictly Lawrence residents? Why can't more people be trained to give the tests? Are the numbers that the state posts on Thursday, are they strictly Lawrence residents, or are they people being tested in Lawrence? Are we catching the Methuen, the Boxford, and the Andovers, and all of those people? Are they being thrown into our numbers? And lastly, how come Lawrence hasn't instituted what they're doing in the greater Boston area, testing sewage, which gives them about a 1 to 2 week lead time in the spikes in the coronavirus? It can be done. I mean, those are my questions. I talked to Stephen about them. Hopefully Mike heard me run my mouth. He's heard me run it enough elsewhere. But these are some questions that I think that we need specific answers. Okay, one last question. This is the biggie. Yeah. I have been vaccinated. I've had the booster shot. Why do I have to go through with the foolish mask crap? Can anybody answer that? Thank you.
Okay. Do you want to start and address some of those questions, or should we address them at the end?
Whatever your preference is.
Okay. I think we should just address them initially.
Sure.
While they're fresh in our minds. I think we should start by addressing the testing sites and...
Testing sites, sure. Okay. All right, thank you, Dr. Gordon. Mike Amano, Director for the Board of Health and Inspectional Services. Thank you for the questions. With regards to the testing sites, currently the sites, 2 of the sites we have are part of the Stop the Spread initiative, which is funded by the Commonwealth, which is why we share our testing with the region and with the state. So anybody's welcome to come into Lawrence and get tested. We do have a slight advantage that we have multiple testing sites in our city compared to other municipalities, but undoubtedly I think we're seeing more than ever. It's still not enough, which is why we reached out and we sought to get an additional 3rd site, maybe 4th site in the city. So the mayor is very supportive of this. My understanding is the Commonwealth is working with us to get a 3rd site, hopefully as early as 2 weeks, and maybe a 4th site as early as 3 more weeks. So hopefully that will alleviate some of the pain of waiting at all. As far as indoors and outdoors, it's a matter of space. We struggle to find space. Some people don't want to set up testing spots in their businesses or in a hall. We also struggle resource-wise, everyone should know, in hiring people. So the testing sites that we are seeking to stand up, we are waiting for people to get trained to do so, and we're not alone in this. This is something that the entire Commonwealth is struggling with. I was just on the call this week with our regional public health directors and directors for public health in the big 14 cities, which we are one of them, and everyone is going through the same pain. And like I said, you should be proud in the city of Lawrence. I know we can always do things better, but we do have some, multiple testing sites and one of the best vaccination programs in the Commonwealth in the city of Lawrence as far as access.
Okay, in regards to the data, the question was, does that pertain only to Lawrence, or is this Lawrence-Methuen data compiled?
So the data is, there's multiple sets of data. I don't know exactly which one you're referring to, but I can...
The Thursday report that the state issues.
Okay.
Okay, and it says we have an average daily case of 107.6. Is that strictly Lawrence residents, or is that a combination of people that have come to Lawrence and been tested from other communities?
One of the Thursday reports that's put out is a municipality report. There are several. If that's the one you're referring to, you can sort it by city. There is the chance that someone could walk into a testing site or a vaccination site and give an address in Lawrence or anywhere. So there's always the possibility for error, but the data is collected by municipality.
And what about, can you reiterate your question regarding the sewer data?
Okay, Nessun had a news article that was posted online. They test the sewage, and it gives them about a week upturn when the coronavirus numbers are gonna start peaking. And I don't know how it works.
But how do you suggest that we apply that data?
I would inquire with, I mean, this testing is done at this testing is done at Deer Island in Winthrop.
Okay.
And they can break it down to the North MDC Sewage District and the South MDC Sewage District, okay? Lawrence, part of what, Southern Essex Sewage Districts is what, 4 or 5 communities?
Okay.
Why can't that sewage be tested?
I'm sure it can be tested. I'm not quite sure how that would affect
Well,
policy or...
it seems to me it would behoove the city to investigate this. I mean,
You're concerned that if there is a spike that
the
it's
spike
being
will show up
transmitted-
about a week prior to
Okay.
the upsurge in the actual
Interesting.
number of cases.
Certainly something that we could look into.
And if it's a down, if the numbers start going down, you know, there will be a certain lag time, but
I hear
it will
you.
indicate something is gonna be happening.
Interesting.
You know, I mean,
And possibly be more prepared.
well, I don't know if it's gonna be preventative, but it'll tell the leaders, the health industry in this area that this is what's gonna be happening, we gotta be prepared
So
for
we can
it.
tighten up our mask mandates.
Yes, exactly, you know. No, but again, I'm amazed it's only, Greater Boston is doing it.
Interesting. No, I did. Now, I think that, you know, nobody anticipated, regarding testing, nobody anticipated that Omicron would take this country by storm so quickly. Our first reported case was November 15th from somebody that had traveled to the United States, but within a very short period of time, it has become, you know, basically the predominant strain and has really taken this community and all communities by storm. The increase in positive cases is astounding. I mean, Lawrence alone went from a very low rate, acceptable rate per 100,000 per day to, you know, well over 100 cases per 100,000 per day, with a positive test rate of 14.65%, which you know is a meteoric rise. So this has put strain on our testing facilities, of which we have more than most communities in the state. And again, just to reiterate, I think, you know, it would be wonderful if we could have more testing sites, but again, staffing is an issue, training, supplies, finding adequate sites. I think alternatives to I don't think many people want to do indoor sites, communal indoor sites, but drive-throughs have been wildly successful. But again, our capacity clearly has been outstripped by the need. Luckily, Lawrence received 76,000 rapid tests from the state. And within a very short period of time, we disseminated those 76,000 tests to 40 social service organizations in our city that disseminated that to our citizens. We have another 70,000 on order. But again, not even that is enough. I talk to 10 to 20 families a day that have households filled with COVID patients. And, you know, it seems like the biggest challenge that we really need to focus on is testing. Testing, testing, testing. And while there is not a single rapid test to be had out there in the pharmacies, we ran out of our supply to disseminate free testing to our community. And the 4 testing sites that we have and the Stop the Spread site, there's still a 4-hour wait, and that is unacceptable. But again, these are testing facilities that are set up by the state, by the hospital. Lawrence, as a municipality, doesn't do testing. We have aggressive vaccination programs, but testing is something that has, I mean, you could call it a failure for not foreseeing a surge of Omicron, but we're hoping that within the next 2 weeks, testing will be a little bit more easy to come by. But I think at this point, I talk to a lot of people that don't even go to one of the testing facilities, that do rapid tests at home, test positive, and follow the CDC guidelines for a 5-day quarantine with return to their community when their symptoms have resolved. And I think we're doing pretty well with that. In regards to your question about mask wearing, I still believe that even if you're triple vaccinated and you have COVID, you can get COVID. I mean, you can transmit COVID. So I don't see why, if there was even an inkling of support for mask wearing indoors, is it that offensive? And wouldn't you give public health officials and scientists the benefit of the doubt for doing what they feel is right to protect our community? I just don't see the offensiveness of wearing a mask. And I think that it's the least we can do, especially for the under 5 community that cannot be vaccinated, or the people that are immunocompromised. So I don't, this rabid anti-mask fervor is so far from my conceptual understanding that I don't even see any reason to debate it. Honestly, I think it's absurd. So that being said, I have the lectern is available for our next public comment.
Hi.
Hi, welcome back.
Hi, thank you. Thank you for letting me speak. So I just wanted to say, good leaders communicate clearly. They don't send mixed messages. Good leaders never stop learning. They have the ability to embrace failure, and they don't create hysteria and chaos, and they don't fill with mixed information. Now, Governor Baker stated, which I don't usually agree with him, but he stated the kids need to be in school. If we've learned anything from this pandemic is the damage that was done to the kids, and it should never be repeated. We have the tools and the capabilities to keep people safe. So what did Lawrence do on Monday? They closed schools. Now, if you look at Lawrence Public Schools protocols, they have A, B1, B2, C. They require testing after day 5 for a kid to return to school. But they state for pooled testing, it is not recommended that any individual who has tested positive for COVID-19 in the last 90 days to participate. Now, why do they say that? Well, per the White House response team, Michelle Lewinsky, she stated that a test could stay positive for up to 12 weeks. So why, on any protocol that Lawrence has put in place that will hinder our children by keeping them out longer, would we require the testing for them to show a negative test? It also states on the consent form from Lawrence Public Schools that a parent has to consent and understand that there is a potential for a false positive. There is a potential for a false negative. Now, we've been in receivership since 2011. I think the main thing is we want our kids back in school. I'll disagree with you on the mask because I have children that have to put it on. It does cause issues with people that are on the autism spectrum, disabilities, a whole range. So for you to say that, I don't know if you have younger kids that have to go through that do have those issues. Now, when it comes to testing, back in July, the FDA put out that they were giving you advance notice on the testing. They wanted a multiplex test that tested for the flu, could differentiate between the COVID and the common cold. What testing is Mass State schools using? And what is it testing for? What antibiotic, what antigen, what protein are we testing for? Because there is a human coronavirus, 229E, that basically is like the common cold. So are those tests picking up on that? where we're creating those false positives? Are we using what the FDA recommended after December 31st? They gave us from July to December. If we're not using the new tests that they recommend, how can we follow some of their rules but not others? That would make no sense. Who makes that decision? Then, DESE puts out that 1,544 positive cases out of 140,000 employees. That's 0.01. You have 8,576 students that tested positive out of 911,000. That's 0.009. We have almost 28,000 positive cases in Lawrence, a vaccination rate of over 95%, I believe, for the higher age group that is most vulnerable. When are we going to start acknowledging herd immunity and natural immunity?
Okay, thank you. I'll start from the end. I think that we've shown that herd immunity is something that is conceptual, and it's hard to put our finger on what constitutes herd immunity. Today, for instance, I spoke to 2 patients that they've had COVID twice. And their last case of COVID was last December, and now they have it again. So the concept of herd immunity when you have variants going from the original COVID to Delta to Omicron is a concept that we don't know when we're going to arrive at herd immunity. The vaccine data is interesting. I don't believe the 99.5%. I don't believe, I mean, I look at the fully vaxxed, 30 plus, 86%. Yeah, we have a lot of people that are vaccinated and boosted, but those people are not, with Omicron, there's certainly a percentage of people that are getting Omicron that are fully vaccinated and boosted. So, you know, I would love to be able to say if you're fully vaccinated and boosted and we reach this percentage, we can relax the mandates and the public health recommendations, but it appears that we cannot. You know, in regards to the school, I gotta say, as a Board of Health official, I disagree with the policy of retesting kids. You're right, PCR stayed positive in many cases for quite a long time. And I got so many calls today from hysterical parents that want to send their kids back to school that can't find adequate testing facilities. A lot of testing facilities won't swab children, for one, which is a big problem. And secondly, they don't accept the rapid test. So I think it's creating so much a situation where parents are overwhelmed. And I really believe that they should follow the school system, including our school system, should follow the CDC guidelines with the 5-day quarantine and the resolution of symptoms. I mean, it's not my call to close schools or not, but I had 3 of my staff members out last week with Omicron, and they all caught it from their kids in the Lawrence public school system. All their kids had it too. So I don't think if half your staff is going to be out, and you have such high rates of COVID, and we have 2,400 cases of COVID in 4 days in the city of Lawrence, and that's only at the Stop the Spread site. Those are only the official testing sites. We had 2,400 cases of Lawrence residents with a positive COVID test, and I can tell you it's probably double that, because half the people I talked to on the phone today were positive with a home rapid test and didn't go to a PCR site. Sure. So you're talking 5,000 to 6,000 individuals in 4 days.
Is that the new test, or is that the one that they wanted it recalled?
That I don't understand. I mean, I don't know everything, and nor do I propose to know everything. But I can tell you that, whether it's the approved test or not the approved test, or it's the coronavirus I have no idea. That is beyond. I don't know. You would think that, of course it matters, but you would think that the Department of Public Health and the Lawrence General Hospital and the people overseeing these testing facilities would be using the proper test, or at least be trying to find out what is the proper test. We've been at this for 2 years now. If there was a test that could determine whether you have a common cold, influenza A, influenza B, or COVID-19, or this other COVID you talk about, in one test, what an ideal world we'd live in, but that's not happening right now. But you open up some very interesting questions that we don't have the answers for you. I'm sorry.
Can I ask you one other question, too?
Sure.
On the vaccine sites that we have, do we have epinephrine available?
Absolutely. I write the orders for epinephrine for all vaccination protocols for the city of Lawrence.
Okay, so there, I just wanted to make sure that that was
Absolutely.
available for the school.
It has to be by law.
And then the other question I have is on the vaccines on the FDA website, they expire on a certain date, and they allowed it to continue for 3 more months, that you can use those expired vaccines. I want to make sure that at those schools, that we're not using expired vaccines.
Yeah, I don't know I mean, we give so much vaccine, I can't believe they're expired.
Don't even have time for the vaccine to expire. We use it right away.
So vaccines,
They have an expiration date on it, and on the FDA website, they're allowing you to use it 3 months past the expiration date. I do not want them at the kids' schools. If the manufacturers of these vaccines want to save money and try to rescind the date, that's fine, but don't give it to our school children.
Do you want to comment on that?
We have Jamie Severino is a nurse manager for the clinic site. She can give a little bit more information, but the bottom line is we don't use anything that's expired that we're not supposed to, but she can explain how the expirations work a little bit.
so there's no vaccines that we use that are expired. When they go before they extend the expiration date, it's way before the manufacturer expiration date. So there's no vaccines that are being used that are not supposed to be.
Perfect, I just wanted to make sure, because I saw that they were allowing that.
Yes, and they do notify everyone about that, and then the new expiration date is this. And written down, it should be correct.
So we're not using it in a 3-month period with the kids.
Okay, well, thank you. We need to move on. I appreciate it. Please come to our next meeting. I enjoy your presence, and you bring up some very good questions, and I appreciate you bringing those to the table. Thank you.
Thank you for listening.
Okay,
Can
all
I
right.
make a motion to accept?
Wait. On the subject and the controversy of mask wearing, do I have a motion on the floor to accept the executive order?
Motion to accept the executive order of December 30th, 2020 for mask usage inside.
Public
indoor, in public,
buildings in the city
in
of
public
Lawrence.
buildings inside the city of Lawrence.
Okay. I second the motion carries. So we do have a mask mandate in the city right now, indoors, public buildings. You can agree or disagree, but that's what the administration has put forward, and we have ratified it today. We're very sorry. I truly believe that within 8 weeks, we're gonna have so many people in this community that have had Omicron and have developed antibody, that are triple vaccinated. I think we're gonna be maybe looking at the end of this pandemic. That's my hope. My fear is that we're seeing more children admitted. You know, the kids that can't be vaccinated. And, you know, in the United States on a national level, it is a little frightening to see the sharp rise in pediatric admissions.
Dr. Fauci said on TV this week that the kids were in the hospital not because of COVID, they were there with COVID. He said that live on TV.
Well, you know, that's his opinion. I hear from ER docs and people in pediatric wards that are seeing kids with low oxygen and have, you know, wheezing and croup. He works at the hospital and he sees that. So, I think that it would be cavalier to assume that that's true across the board. But I'm hoping that Omicron is so widely spread that very shortly maybe we will reach herd immunity and we'll be looking at a spring and summer that'll be a little bit more like our summer past, that we were able to enjoy our lives and enjoy our families and not have to wear masks. But I always like to err on the side of caution in life, because when you don't, you're always faulted in hindsight. So I'm going to move on. Thank you. All right. I'd like to jump ahead to Caesar. We're going to talk about tobacco control.
Yes, thank you. My name is Caesar Quentin, Director of Tobacco Control. For the record, we have before the board 4 establishments for a temporary suspension. Before we get to the suspension hearings, I'd just like to address the board's memory as far as what I recommended last meeting. The state law itself a non-leader for a first offense under the new state law.
Push on the mic. The mic.
2019. Yes, again, for the record, my name is Cesar Punch, I'm Director of Tobacco Control. This is my report, and in the interest of time, I'd like to just refresh the board's memory as far as what we discussed last meeting, which was I recommended the board, instead of looking at what the state law says, that you can suspend a tobacco permit for up to 30 consecutive business days, to look at these first offenders and set a specific number of days for this purpose, because this will be more consistent. A second offense under the state law for any offense under that same regulation is 7 consecutive business days. So I recommend the board for a first offense to be 3 consecutive business days of tobacco permit suspension instead of up to 30 days, because this would be like too easy for you to be inconsistent in your decisions, future decisions, and also it wouldn't make sense to have a suspension for 30 days when a second offense for any violation is 7 days. So my recommendation is if you find that a particular store actually committed a violation, that you decide to suspend it for 3 consecutive business days.
Okay,
Make sense?
yes.
All right, so let me just ask, because I like to do this in the order that appears on the agenda, but I don't think that one of the establishments is represented here. Is anybody here from One Stop, Pit Stop Convenience? No? We could just take this out of order if the board would
That's
allow
fine.
it. I understand that E-Market is here. So if you could just want to come up and to the podium, just in case you want to address the board.
Good afternoon, this is Ines Nashid, owner of E-Market, located at 390 South Union Street in Lawrence.
If you just wait a second, I'm just going to present the board what happened, and then you get to address to the board, okay? This is a 17-year-old girl that was used in that day for this compliance check on August 9th. Her birth is June 3rd of 2004. She was 17 that day. This is how she was dressed. The photograph was taken on the morning of the compliance check. This is a pack of cigarette that was purchased at 390 South Union Street, E-Market. And we just want to pass this along to you. So you can
This is a first violation?
It's a first violation under state law, and we're looking at every single violator now as a first offender because we are citing them pursuant to the state law.
Okay.
So,
It's a little girl.
yeah.
Why would you sell to a little girl?
You know, I know it's a mistake, but it's a human mistake.
Don't you train your staff that they need to card?
I noticed him, but he's an old man.
Okay, doesn't make a difference. All right, so can we just make a motion to,
$1,000,
what's that?
it was $7,000, given $1,000 fine, they paid the fine.
Okay, so we're making a motion to 3 days suspension.
Can I make a motion to suspend E-Market for 3 days?
Second the motion.
Excuse me, just one second.
Yes.
My suggestion
I'm,
is the 25th of January, it's a Tuesday, and then 26th, Wednesday, and 26th, 7th, 13th, so 3 consecutive.
Okay. Yes.
hi,
hello.
this is my wife.
Okay.
I work with her. Since 2000 until now, I don't take any ticket. 2006, I'm manager for White Hand Inventory. 2006 until 2019, 7-Eleven franchise. I opened a new store, E-Market, just couple of years. I don't have any trouble. Is my agenda clear? I don't have any problem.
Yeah.
What happens, the old guy, he not understand, and you know this time is tough for employee. I
Yeah.
don't have any people. But first step, for 20 years, I don't take any ticket. I work, start 2000 until 2021, I have nothing any trouble. I have nothing any problem.
Yeah, I don't think we have the ability to just, you know, the first offense was supposed to be a 30-day suspension. You already paid your fine, and I think by law, we're I think, obligated to do a 3-day suspension, which I mean, that's just the way it is.
But why this first step? Give me patience. Is this first step for one ticket after 21 years?
Problem is, we have the law set up the way we have the law. If we give you an exemption for the 3-day suspension.
No, but I know
And everybody will ask for a 3-day.
I'm sorry, this is a first law, first ticket.
Well, the whole thing is the first
No.
offense is a 3-day suspension. The second one, if this was a second one, it would be a 7-day.
But why you sent for me, Lara? Tell me if after first ticket I can take 30 days.
It's not- doesn't work like
Nobody
that.
sent for me any information about the stuff.
We've been educating the establishments in the city of Lawrence since 2019, when the law was first passed. It was passed in December 2019. Since then, we've been doing visits. We slowed down with the visits once COVID pandemic began, but we have been educating them. We have sent mailings to all retailers at least 2 or 3 times. So everybody's been aware of this. And the law doesn't allow for the board to not give somebody a suspension. It's what the law says. If the board finds that a violation occurred at your store,
Why do we even
then
have
the
a
board
hearing?
must suspend.
So why do we even have a hearing if the law is the law?
Well, because you can suspend up to 30 business days.
Okay, we're giving you the minimum. We could suspend you up to 30 days. We're not doing that. We're giving you 3 days. They're days that Cesar has selected, and, just please educate the rest of your employees. We can't give you 0. You got that? It's not in our,
After one ticket, 3
one
days?
ticket is up to 30 days.
Dr. Gordon, I'm sorry, can I, just for purpose of clarification, Cesar, could you explain, is this 3 days suspension of the business or 3 days for tobacco sales?
As was stated in the beginning of this hearing, it's a tobacco permit suspension. It's not a business or license to operate suspension. So you won't be able to sell tobacco products. You'll be able to open and sell other products, but not tobacco. So you're going to receive a certified letter basically saying that you have to remove all tobacco products from the front of the store, put somewhere in the back until the end of the suspension. So while you're here, I just want to say that at the time when the suspension begins, which is at the beginning of business on the 25th of this month, that should be no tobacco on the premises on the front of the store. All right? And then you can just bring the tobacco back at the end of business day on the 27th, which is the Thursday.
There's nothing else I can do. We're giving you the minimum, and you can still operate your business, but you just can't sell tobacco for 3 days. If I could do more, I would, but I cannot.
When it starts 3 days? When it starts 3 days, Mr.
25th of January.
The 25th until 25th morning?
25th, 26th, 27th.
On the beginning of business on the 25th, there should be no tobacco there when you open the store, okay? So you should remove this the night before. And then you have to keep the tobacco away until the end of Thursday, the 27th. At the close of business, you can just bring the tobacco back. All right? Just make sure you have a valid tobacco permit for the state. The next establishment is Tropical
Thank you.
Supermarket. We have Stephanie De La Rosa here, and this is the pack of cigarette that was purchased at 127 South Union. The cost of the product was $12. Same day,
Same
Same
girl,
person?
same teenager?
17, yes.
Okay. So this is a first offense?
We're treating every single one as a first offender
Okay.
because we assign them pursuant to the state.
I gotcha. And then they paid their fine?
They pay the fine as well.
Okay. Do you want the 3 days or the 30 days?
3 days.
Okay.
Yeah,
If I
I'm
could do
sorry.
anything different, would you like to say
Oh.
anything?
I would just like to apologize on behalf of the Tropical Mini Market family. Our staff was undertrained at that time. We have properly trained all of our personnel, and it won't happen again.
I really respect that, and if I could give you 0 days, I would, because
Appreciate it.
coming before us and just owning up to it is, I think, is a good thing. So
Appreciate
3
it.
days, he'll tell you the dates, and you can still operate your business.
The 26th and the 27th, the suspension begins at the opening of business on the 25th. There should be no tobacco products on the front of the store at that time. You will receive a certified letter with these details. I'm going to come on that day and post a sign for the suspension. And you should keep the tobacco away until the end of business on Thursday, the 27th.
Thank you for
Thank you so
coming.
much.
All right, good luck.
Go ahead.
Okay, for pit stop, no, E-Market on 390 South Union,
I'd like to make a motion for suspension of 3 days of their tobacco license.
I second the motion.
And then this one was Tropical Market.
Tropical Supermarket and Restaurant, 127 South Union Street.
I'd like to make a motion for, what is this? I didn't bring my glasses. Can I make a motion for, which one is it?
Tropical Supermarket and Restaurant.
Tropical Supermarket and Restaurant, 127 South Union, Lawrence, for suspension of license of 3 days.
Second the motion.
All right, the next one who's represented here is Mi País Market. The violation occurred on the 12th of August. This is the same youth that was used in the previous compliance checks. She's dressed differently, that's how she was dressed that day. This is a pack of cigarette that was purchased there. It was $11, purchased at Mi País Market. Would you like to address the board?
¿Podría hablar en español?
Sí.
Ok, sí, sé que fue un error de la trabajadora que yo tengo allá, que no tenía mucho tiempo. Y cuando ella le preguntó, simplemente le preguntó a la muchacha que fue, yo no estaba. Le preguntó, ¿cuántos años tú tienes? Ella le dijo 24. Sé que es un error de ella, porque no por lo que ella le diga, ella se tenía que llevar. Y fue el error de eso.
Okay,
ahí.
so he's saying it was a mistake of his employee. She asked the girl how old she was. The girl said she was 24. She didn't check an ID. Así existe la ley. Pues,
Claro, yo entiendo que fue un error de
si
ella.
te
pero-
vamos el mínimo, porque la primera vez y el ley ha cambiado mucho, está mucho más estricto. The law has changed, it's a lot stricter than it has been. So,
Mr. Gordon, just for clarification, the minor was asked for, she was not asked for ID, she was asked her age.
no, I know that, yeah.
She did not provide her age.
Okay.
She just pursued it. Are you gonna sell it to me? That's how she was trained. Are you gonna sell it to me? And a sale was made. So you cannot sell to anyone if they don't have an ID to present. It doesn't matter how old they look. It's the new law. If somebody comes and asks for a tobacco product, they have to present an ID, and you have to inspect that ID.
Si la muchacha está entrenada de no decir su edad, no dijo 24
No, yo
años.
entiendo eso, sé que
Pero
fue un
no te
error de ella.
preocupes, es la primera vez, ya sabes, vas a educar a tus empleados, you'll educate your employees, ya pagaste la multa, es un poquito duro, seguro que no vas a repetir it.
Bastante duro.
I'm sure that you're not gonna repeat. And so, motion,
So can I have a motion to suspend the license of Mi País and 610 Andover Street for 3 days?
second the motion.
So you take a vote?
I mean, all
Vote
in
to
favor
suspend.
for all three suspensions, aye.
All right. Next.
Gracias.
Ya eso es todo, ¿me puedo ir?
Sí, sí, señor.
Is anybody here from Pit Stop Convenience? Yes, ma'am. Just for the record, every single one of these retailers were notified via certified mail. As far as Pit Stop Convenience is concerned, the mail was delivered on December 20th, 11:24 in the morning. Same situation, this violation occurred on August 9th. You have the picture of the youth used that day. They paid a fine of $1,000, but they have chosen not to appear at this hearing. The board doesn't need to have them present before you can make a decision. So my recommendation is that you suspend them for 3 consecutive business days, as you have done the others.
Okay.
Can I have a motion to suspend Pit Stop Convenience, 130 Winthrop Street?
50.
150 Winthrop Street, Lawrence, Mass. for 3 days?
I second the motion, all in favor? Aye.
Thank you.
I need glasses, bro.
Oh, I know, tell me, you're singing to the choir. All right, thank you. We'd like a general report from our city nurse, Jackie Aguilar.
Good evening, everybody. We continue doing a lot of contact tracing to prevent the spread of COVID. I'm sorry. Good evening, everybody. I'm Jackie Aguilar. I'm the public health nurse, and here with me is Jamie, who we are nurses and trying to prevent the spread of COVID as we're doing vaccination, contact tracing, and helping the community understand that they have to set up, a system of staying home, isolating if they have a positive COVID test. So far, I have encountered multiple families that have COVID, and they've been spreading every 5 days. The spread has been going on and on. So multiple cases have been having COVID 2 and 3 times, as far as I have encountered, 3 times. So it's very, very important to educate your family members that if they have COVID, please stay home. Please stay home if they can. Please get a babysitter. Please get some, because we live in generational families. It will be awesome if you have some help so that you don't have to miss work. If you're positive, you have to stay home. We're saying now, stay home for at least 5 days if you have no symptoms. But if you have symptoms, you have to stay the full 10 days. So when I say stay home 5 days, that means that you go to work on day 6. When I say stay home 10 days, you have to go to work on day 11 if you have symptoms, okay? So we have seen many symptoms from different symptoms that resemble a cold, but we still have seen a lot of symptoms that are like back pain, runny nose, congestion, a lot of symptoms like the typical, headache, fever, and I have encountered a lot of asthmatic people that are having a tough time. Asthma is something that is vulnerability for COVID, and I have found that they get the worst of the COVID. So a lot of people test their oxygenation if they have asthma, and I recommend them to do so if they can buy that little machine at the pharmacy to test your oxygenation, because sometimes they go very low. There is a lot of education to be done for asthmatics at the doctor's office, because sometimes they feel very short of breath, and they have no idea that their oxygenation at 70 is very low. So we have to educate, and we have to make sure they're doing the right thing. We have a lot of babies also that have a lot of symptoms, and fever is very high on kids, on little babies. So let's protect the community. Wear your mask, please vaccinate, do their booster. We are going to the schools. As soon as we get approved, we're gonna go back to the schools. So we're working really, really hard.
Have you started offering vaccine to the 12 to 16-year-old crowd now that it's been approved by the FDA?
Not yet.
So if they come in with a parent looking for the vaccine, you're not offering it?
Not yet. Once CDC puts out the guidelines, then we
Okay.
can go forward for the 12 and up.
Yeah.
For boosters.
That's correct. So that's it. Thank
Okay.
you.
All right, I appreciate the update. Jamie, would you like to say anything regarding our vaccination efforts? Our heroic vaccination?
Just short, I don't know if everyone's vaccinated here, but it's great to provide education around the vaccine and the importance of getting vaccinated, getting our kids vaccinated. It's very effective in preventing kids from going to a hospital unless you have underlying conditions or special cases. Everyone's different. But what I see, symptoms are not as severe, and you don't end up in the hospital intubated fighting for your life, and that's our point. We want to get everyone vaccinated and reach a point that we can all be safe and ease on the mask requirements. We're available. We don't have walk-ins available. We're available to the city. We do home visits. We have a number to call. I have some calling cards to give to you all if you're interested, that you can share with the community, because we do home visits. We have walk-ins available at the senior center Monday through Friday from 9 to 3:30. We have City Hall. We do first, second boosters from 8:30 to 5 Monday through Saturday.
Wow, excellent. Thank you. Do I have a motion to adjourn?
Could I have a motion to adjourn? Yeah.
Second motion, all in favor? Yes. Thank you for coming tonight. We'll reconvene towards the end of February, actually. I'll send you all the dates.
Good, thank you.
Sounds good. Thank you, everyone. Would anyone like some calling cards to share? Oh, I'll leave some here.